Patients and public health facilities are grappling with the possibility of yet another strike on Sunday as the deadline issued by the country's nurses looms. Starting midnight, at least 25,000 nurses in public health facilities across the country who fall under the Kenya National Union of Nurses are set to down their tools. The bone of contention, a collective bargaining agreement that is yet to be effected by the government. In December 2016, the union signed an agreement with the Ministry of Health and the Council of Governors, ending a week-long strike. Parties agreed to expedite the conclusion of a harmonized collective bargaining agreement. Under the deal, nurses were to benefit from improved terms of service, with a health service allowance among the expected perks. Months later, the CBA is yet to be signed, with the nurses claiming to have received a health service allowance just once before it was discontinued. In the face of these allegations, authorities now shifting the blame to each other. The Council of Governors claims it did its part, concluding negotiations between the Nurses Union and the county governments, after which it forwarded the document to the Salaries and Remuneration Commission for action. In a letter dated 31st May 2017, stamped urgent, the COG Chief Executive Officer Jacqueline Mogeni expressed her concerns to her counterpart at the SRC. Mogeni imploring the SRC to give the green light on the agreement. The SRC could not be reached for confirmation. In a statement, however, the CEO has asked nurses to stop piling undue pressure, saying the process will be through as soon as SRC provides a no objection letter. The possibility of another strike a cause of concern for Kenyans, coming a few months after another strike by doctors and nurses brought health services to a halt. With just 64 days to the general election, the threat could not have come at a worse time for Jubilee, as it could become yet another talking point during the campaigns. On 28th of May, doctors gave the government a 16-day notice to complete negotiations on a collective bargaining agreement or face another strike. The latest threat coming a day before workers under the Kenya Union of Domestic, Hotels, Educational Institutions and Hospital Workers begin their strike, the union accusing the Ministry of Health and the Board of Kenyatta Hospital of non-payment of emergency call allowances for clinical officers and health service allowances for health workers, matters that remain unresolved. Wilkis Anyabwa, Sunday Live.